When evaluating a patient with low back pain, it is important to perform a detailed physical exam and obtain a detailed history from the patient describing the pain and when it began and their description of the pain. With this detailed history and physical exam, you should be able to determine if any further lab or diagnostic imaging tests are needed. The majority of cases of low back pain do not require any imaging or lab tests to be performed. The few exceptions to this would be when someone gives a history of back pain that is directly related to or caused by a traumatic injury. Then further imaging tests would be required. Also, if they give a history or report that they have had a loss of bowel or bladder control, definitely incontinence can be an emergency situation when you're talking about, especially talking about back pain due to the nerve damage that could be occurring. Also, if there are other signs and symptoms of severe nerve damage, such as a patient who has had a history of back pain or pain radiating down their leg or numbness or tingling, but then suddenly they're not able to move their leg or their foot, they have what we would call foot drop, where their foot does not move when they want it to. That would be a sign or symptom of severe nerve damage and would require further diagnostic testing. If these things are not present and the patient's complaining of back pain, first, a trial 7 to 10 days of conservative treatment would be appropriate. If most, like 85% of cases of back pain will resolve with conservative treatment. There should be a follow-up within 7 to 10 days to ensure that the symptoms have been relieved or that they haven't gotten worse at that time. So when dealing with back pain, just remember that a detailed history and physical exam can help you determine or will help you determine if diagnostic testing is necessary. The majority of the cases can be treated conservatively unless, of course, there are the severe nerve damage signs or there's been a traumatic injury that has occurred.